Hello, everyone. Welcome to TALRadio. This is me, RJ Saankhya, hosting through the interview today. This is the show where TALRadio proudly highlights extraordinary organizations and the remarkable individuals behind them. So today, we try to bring spotlight on this wonderful organization which is making a huge difference in healthcare sector. That is Emilio Nares Foundation. Today, we have the honor of delving into the inspiring story of the Emilio Nares Foundation, a nonprofit organization that has been transforming the lives of children battling cancer and their families since its inception. So, joining us for this enlightening conversation is the remarkable founders of the foundation, Richard and Diane Norris. Richard and Diane Norris, a truly visionary and compassionate couple, founded the Emilio Nares Foundation in honor of their son Emilio. With an unwavering commitment to supporting families facing the overwhelming challenges of childhood cancer, their dedication and resilience have made a lasting impact on the countless lives. And their belief in the power of love, hope, and community has been the driving force behind Foundation success. So today we are privileged to have Diane and Richard Nares with us today and to share their journey, insights, and the profound work of the Emilio Nares Foundation. So without a further ado, let's welcome Richard and Diane Norris onto the show. Hi, Richard and Diane. How are you doing?
Good
Hi.
morning. Thank you. Thank you very much.
Good morning. Thank you so much for having us, Sankita.
Good morning. Thank you. Actually, we are really glad that you can make it today here, and thank you for giving us your time. So I would start with the first question. So you and Richard seem to be a really inspiring and powerful couple, right? So can you let us know a little bit about you guys? And also, would you like to share the story behind the establishment of this beautiful foundation?
We certainly would. Thank you for giving us this opportunity. Yes. So Richard and I, we always say we met later in life, first time marriage and motherhood to Emilio, our son. And we started the organization because our son Emilio was diagnosed with leukemia when he was 3 years old. And he had a tumultuous 3-year journey of remission and relapse and a bone marrow transplant ultimately. Unfortunately, back in 2000, we lost Emilio to his cancer and also to the rigorous years of treatment. And a couple years after his passing, Richard and I felt ready to enter that world again of childhood cancer. Take baby steps back into Children's Hospital where we live in San Diego and start to see how, because of our journey, we could help other families in need with just some basic steps along the way.
It was because of Emilio's journey that we witnessed firsthand what families go through actually living in the hospital. That's what we did for days, sometimes weeks on end. And Diane and I are very fortunate to have a large family, and we had a great support network. But many of the families that were in there at that time did not have that safety net, did not have friends and family to go to for some of the critical needs that they had to have. And one of them was basically transportation to get to the hospital. Again, we were fortunate because we had rides, but many of these families may have one car or no car, and it makes it extremely difficult to get to the hospital because generally the one parent takes it to go to work and that leaves the other parent to either take the bus or rely on friends or cab, which are really not advisable with these children because their immune system is compromised and they're very susceptible to germs and everything like that. So our flagship program was started called Ride with Emilio because of all the things that we witnessed due to lack of transportation.
I'm so sorry about Emilio, but I really appreciate how you didn't let the grief pull you down, but instead, make something so profound out of it. So, can you guys provide a much detailed overview of the Emilio Nares Foundation and its mission?
Sure, certainly. I'd love to start with the mission, and that is that we navigate families through their child's cancer journey every step of the way, from the beginning of diagnosis throughout a variety of programs that we offer that can add services to make their journey just a little bit less stressful, which is our goal. And Richard mentioned Ride with Emilio. So our transportation program, since the beginning, which, by the way, this year, 2023, is our 20th anniversary. So it's been a really long time. We started here in San Diego County, and then we moved into Orange County in Southern California to the Children's Hospital there, and Imperial Valley, which is a part of San Diego as well. And then now we have a van up in Los Angeles. And LA is really where we want to put efforts in building support and financial support so that we can run our programs. Because in Los Angeles, there are at least 1,600 children annually who need transportation to get to that LA Children's Hospital every single week for treatment.
Wonderful. And first of all, congratulations on your 20th anniversary. So there are many interesting programs on the foundation, right? Like Ride with Emilio, Emilio's Living Dabs, or Emilio's Snack Bag, etc. So could you elaborate on the programs and services offered by the foundation?
Yes, absolutely. Besides, like you mentioned, Ride with Emilio, Emilio's Loving Tab shirts is another really critical component of our foundation that we offer to the families and the children. And what that shirt is, it's a specially designed, patent designed shirt that has snaps on one shoulder and down the sleeve. And what that does, it allows the doctor or the nurse to easy access to the child supported calf, is that's where they get their chemo and all other kinds of medicines during their treatment. And the reason that this shirt is so important is because during Emilio's time, this shirt was not available, obviously, but it's a very stressful for the children to either pull up their shirt or take their shirt off for a number of reasons. At his age, he was just stubborn. Sometimes they're cold. Sometimes they're just so frustrated with the lack of privacy because they have to take their shirt off. So when we got this shirt and we were able to have a patent, our goal was to provide these shirts free of charge through corporate donations or donations, and to give these to the families. And what has happened with this particular shirt, this program, it's been extremely successful because what it does, it just allows the nurse or the doctor easy access. It takes away the stress, not only to the patient, but to the parents as well, because we felt that stress every time Emilio had to take his shirt off. So we're really proud of the Loving Tab shirts. And again, our goal is to get this to many children's hospitals as we can with the donations that we receive. But we also have a sewing and knitting program that is another critical component. And you wouldn't think that much of it, but what this program does, it allows these families to get together, the parents, and to discuss their child's, what's going on in their lives. And it became a therapy group. Unintentionally, we didn't think about it, but these families love to get together, and it brings them out of their room and where they spend most of the time. So when the knitting program is going on, it allows this kind of a recess for these parents to talk to each other and to comfort each other. So again, it's another simple program, but it has a huge impact.
We also have a resource center within children's hospitals in San Diego and Orange County and soon to be Los Angeles. And we are the only outside agency that's allowed into the oncology unit. And we have computers available to moms and dads. We have a library of books, anything that they'd want to find out, in addition to what, of course, the social workers are providing for them in terms of information about their child's illness. And our staff members there are very knowledgeable. They're bilingual. They speak fluent Spanish as well as English, and they're able to help the families. Again, that's a part of our navigating families through this horrific journey that they're on.
And it also allows the parents, some parents who are there for days or sometimes weeks on end, it allows them to continue doing their work. Some use our fax and copy machine to send, communication. So it does a lot of these different things for these parents to help them continue to support their family. So it's really another critical program that allows these families to contribute and to keep their family strong and financially, hopefully, that will help them.
Wonderful. I'm sure there are many, but could you share some success stories or examples of how the foundation has positively impacted the lives of children and families?
Yeah, we have so many stories, but one of the first ones that stands out in my mind is that there was a little boy with a brain tumor. He was 2 years old, and we're here in San Diego, but their home was about 45 miles away from the hospital. And before Ride with Emilio, they would have to come 3 times a week by bus. They would have to leave their home at 4 o'clock in the morning, change several times to the buses, and then take the same over 3.5 hour trip back home with the little boy that had a brain tumor and was sick a lot of times after he got his chemo and his medicine to go back home. So when we started Ride with Emilio, they were one of our first patients. And when we went to pick them up, the parent couldn't believe that we were there, for one, and two, that it was free. And so it was just a remarkable difference in her that she was getting the support by this free transportation every day, whenever she needed, from her door to the hospital and back again, in a safe, clean environment. And about a month later, the office, she brought like a whole case of avocados to pay us, and her gratitude. And it was just such a heartwarming thing. And we know that we were doing our job and to get these families to and from their appointment safely in a clean environment. And like Diane mentioned, if we can take a little bit of stress off this horrific disease to the families, we know we're doing our job.
Something very unique about Ride with Emilio program is that the children are literally picked up right at their front door by ENF's drivers. And the van has music that always plays. The driver becomes like a family member to these families. They're so comforted by him or her. And then they're immediately taken to the facility for their treatment. And then, as Richard mentioned, picked up again later in the day and then taken home. And they're tired, exhausted after a day of chemotherapy and other treatments. And they're brought home safely and they can rest in a clean, hygienic way, as opposed to public transportation. So there are many stories to share, most definitely.
Thank you. Thank you for that answer. So moving on to the next, in what ways does the Emilio Nares Foundation collaborate with hospitals and healthcare providers?
Well, our programs would not be possible if we didn't have the relationship we do with these hospitals, because, of course, the information from these families is very personal. And so we were lucky enough and privileged enough to have this relationship that we work very closely with the social oncology, social workers, to find out what parents and families need our services. So we work directly with them. So the hospital knows what kind of services we're providing and what they're getting from us. And it's a very close, good, excellent working relationship that is critical for the success of any program that you're working with a hospital. But we really see how that has helped us tremendously because of our 20 years of service to them, and just impeccable, but also following every regulation to the T and everything. So it's just having a good relationship with these hospitals to make these programs successful.
ENF's transportation director, actually program director, Luz Quiroga, has been with us since day one. And she is hands-on in that unit, completely connected to, as Richard said, the social workers and the parent liaisons, which are parents who have been through a cancer journey with their child. And then they go back to children's hospitals and they work with the families there. So Luz is representing ENF, but she's connected with them as well. And most certainly with the parents and the children.
Great. So are there any specific criteria or eligibility requirements for families to benefit from the foundation services? And also, if yes, how can they reach out to you for help?
Oh, absolutely. They can go, there's a direct 800 line number to ENF. And our brochures and our business cards are right there at every children's hospital, handed out to families who are in need. The transportation is arranged internally, as Richard mentioned, but it's certainly the families could call our number, go online, whatever they need to do. There is someone always available to talk with them and to take those first steps. As we said, we are there from the very beginning, the diagnosis, all the way through, no matter what the outcome is.
I to add to what Diane is saying, it's just, we really pride ourselves and not only being hands-on, but just to respond quickly to these families. And like I said, we've been around for 20 years, and I've witnessed other organizations, great ones, but there are times when people don't respond fast enough to these families. And these families are really looking for help, and any delay in response, they lose hope, they don't know where to turn, and they feel more lost, even lost. So we have a very good response time to these families. Like Diane said, there's a phone number. Here in San Diego, we have quite a presence, so we can be sought out from the families that are on the floor at the hospital. So there's definitely a multitude of ways that people can contact the foundation.
Great. So what are some of the major challenges the foundation has faced so far, and how have you tried to overcome them?
Well, one of the biggest challenges was the fuel price. Gas prices have really been extremely difficult. COVID, again, was another huge obstacle. And COVID, for the reason is that instead of bringing several families at a time in a van, we could only bring one family at a time. So not only did gas prices affect us, but multiple trips than we normally would take happened during that time. So,
and another point I'd like to make is that during the pandemic, which certainly existed for almost 3 years, of course, as Richard said, one child at a time. So you can imagine our drivers, nervous anyways about making sure they're keeping their health good and solid, and they're testing daily before they get in that van to pick up a child, but also the amount of trips it would take in the course of a day with one child at a time in a different geographic area. San Diego is so huge that way, as is Orange County. And during the pandemic, we had not been in Los Angeles yet. So these are children who are used to wearing masks. They have to wear masks when they leave their homes if their blood counts are down. So counts are down, you put a mask on to go to the park, you don't go to school, and you put a mask on if you're going to be around anybody else. So here we are, right? We're just all trying to get used to wearing masks, and we're all scared to death of the pandemic. And then you have children, and they're going to clinic. They're getting in the van, they're going to clinic, but one at a time. So that was a huge, huge challenge that ENF faced during that time.
Great. So how can individuals and communities get involved and support your organization?
Oh, we absolutely encourage them, again, to make that call or go online. There's even an area there called for volunteers, so they can do outreach to say that they're interested in volunteering in some capacity. And we welcome that. I mean, one of the key parts of our own personal journey healing was when we started serving others. So for anyone out there in these big communities, there are so many different ways of helping ENF, and it's just about the outreach and the gratification, but also the passion and compassion that will come from helping others. Is always necessary.
Great. So this might be a little personal question to you guys. So in the face of such an emotionally demanding work, what strategies do you practice to maintain your own well-being and resilience?
Great question.
To me, I'll answer my own personal, is that it's just my faith and my belief on why I'm here doing what I'm doing. I mean, it's the last thing I ever thought, before Emilio passed away, that I'd be doing this type of work or mission, calling, whatever you would like to say. But I feel very strongly that meditating and being peaceful and knowing that just in my heart that we're making a difference in families that need help. And I just know I couldn't live the other way after Emilio passed away. And the other way means in a dark space, in a dark, in a room without really living. And I just knew maybe he nudged me to do something. I'm sure he did, nudged me to change my life and to be here and do something that's of value. And that is, to me, is to really see these families smile and see them have hope after going what they went through and what we went through, just to be in a better place.
And I'll just add to that. I completely agree with Richard, but also there's no moving away from grief. Grief is always a part of one's life after a catastrophic loss of any kind. But the loss of a child, there's no sensibility. It makes no sense at all. But there comes a point where one has to make that choice. I can sit on the couch all day for the rest of my life, or I can get up and just start taking those small steps towards recovery. And that can be, as I mentioned, in service to others. But I also do believe that there is a greater purpose, certainly in my individual life, that there is more to be done. And Emilio would want us clearly to get up off that couch and move forward by helping others in what we knew intimately for so long.
That is so touching, and I'm sorry if if I've asked a question that has to take a lot of emotion. So, but yeah, this is really wonderful work that you guys are doing. And lastly, before we go, what message would you like to convey to our listeners about the importance of supporting the organization like the Emilio Nares Foundation?
I would just like to say that there is an amazing group of people behind this organization. Richard and I founded it 20 years ago, and we're still very much involved. But there is a team of people running this every single day. And many of them, most of them, in fact, have been with us since close to the beginning. And so the passion is there, and the commitment is there, and the devotion. And it's a really simple need, as you can see. It's just, we're not working towards curing cancer ourselves, or we have always wanted it to be the basic day in, day out needs that a family has that we can offer to take away, like Richard mentioned before, a little bit of that stress, make it a little bit easier. But most importantly, know that they are so loved and so understood by people who know what they're going through.
And the rewards one gets by doing this type of work is truly healing, for one thing, and just an incredible healing for me, and I know for Diane. But I encourage volunteers and to come and to see and to really look at these families and what they're going through. It's going to change their life. I mean, that's what we want to see, is someone who didn't know about our organization come and really see the work we're doing and have that effect on them that they've had on us, these families, these children who have to go through this, again, horrific disease for several years. And it's just life-changing. So to have that opportunity, we really welcome people to check out our website and to give our staff a call and see what's available to them to have a life-changing opportunity, truly life-changing opportunity to meet these families and these children.
One last thing I can add to that is that we have several events a year where we raise funds, and they're wonderful. And annually we do a food and wine and craft beer and spirits tasting event here in San Diego at Costera on Harbor Island. And there's lots of information about everything that we do online, but this is the big fundraiser of the year, and it's coming up September 10th. So I'll just mention that for anyone who might be interested. It's a great fun, wonderful way. And there's always some of the children who are doing well and healthy that come and speak. And there's a lot to be learned about ENF from attending this beautiful event.
Wonderful. So I really wish, with the vast listeners of TALRadio, I really wish that they take initiative to contribute to the foundation. And I know they would, because definitely, why not? The foundation is serving such a large purpose, right? So yeah, that's a wrap. And thank you guys so much for joining us today and sharing your insights on the Emilio Nares Foundation. And your dedication to transforming lives is absolutely inspiring. And I must say that out of all the other interviews so far, this is the most moving yet inspirational one. And it was an honor to have you as guests, you both, Diane and Richard. Thank you so much for being here today.
Thank you so much for having us.
Thank you so much for having us.
Thank you. Wonderful. So that was Richard and Diane Nares, founders of Emilio Nares Foundation. For more information about them and to reach out to them, you can visit their website www.efnhope.org. I repeat, www.efnhope.org. Hope you find this interview insightful. For more such interviews, stay tuned to TALRadio, powered by Touch Your Life Foundation. And this is me, Saankhya, signing off for today. Take care, you all.